Hello everyone, my name is Endreya McCabe. I am a member of the Delaware Nation. My mother is Delaware, Caddo, Comanche, Kiowa, and Apache. My father is Navajo, and I am an enrolled member of the Delaware Nation. I have one child. Her name is Logan. She's here with me today. She's an enrolled member of the Wichita tribe. I wanted to talk to you today about social indeterminants and inequality in healthcare for Native Americans. So just to give you a little bit of background, I work for the Indian Health Service. I have worked for the Indian Health Service this is my 15th year. I've had 2 different positions within Indian Health Service. I have also worked for Gila River Healthcare. I don't know if you guys know what Indian Health Service is. The Indian Health Service was created by the federal government as a result of treaties that we had with them. So in exchange for our land and our resources, they gave us free health care. And out of that came the Indian Health Service. I started working for the Indian Health Service, which we call IHS, 14 years ago as a medical technician. I worked in the lab at Phoenix Indian Medical Center for 14 years. In that time I did testing on patients. I did testing for HIV, for STDs, for syphilis, did tests for microbiology. So we basically did all the tests for all of the patients that came to the medical center. Ever since I was a small child, I always wanted to be in healthcare. I originally wanted to be a pediatrician, and then I decided that I was going to change my path once I got into college, and decided they did not want to do that, that I actually wanted to be in the lab. So I wanted to be a part of the healthcare process, but I wanted to do it behind the scenes. So I actually went to school, and IHS gave me the scholarship to be able to do that. And as a part of my payback to the IHS, I went to work at Phoenix Indian Medical Center in the lab. My intention was to stay there for 3 years, and I ended up staying there for 14. So during my time working in the lab, that's how the idea for my thesis came about, was for Native Americans living with HIV and AIDS that were from the gay and lesbian and transgender community. So that's actually what I did my thesis on. And the reason I chose to do that is because working in the specialty field, when I was doing all the HIV testing and the STD testing and the hepatitis testing, I started to notice that there was a lot of young males that were newly diagnosed with HIV. And so then I started thinking, okay, well, what is the reason for this? And because I am friends with a lot of gay men, I'm a friend of the community, I started talking to them about, like, what do you think? It's gonna fall. What do you think some of the reasons might be for this? And so that kind of sparked several different kinds of discussions. So I thought, let me go ahead and just and explore this. So when I wrote my thesis, I actually did lots of interviews with several different people. And it was determined that in the young males, they felt as if they were indestructible, that it wasn't going to affect them, and that they could live their lifestyle and do what they wanted to do, and they weren't going to be affected by it. Well, it turns out that they were. So also during that time, and also in my research, and currently what I do now, so I did mention that I worked in the lab for 14 years, and then I left and I went to work at Gila River Healthcare. We're also working in the lab for a little while, and then I came back to the Indian Health Service, and now I work in the Office of Performance Improvement and Quality. So I am the performance improvement for the hospital currently. And so in the time of doing my thesis and also working in the lab, I wanted to talk about some social indeterminants and inequality in healthcare among Native Americans. So some of the social indeterminants that I want to talk about today that are across the board for Native Americans are poverty, trauma, politics, neglect, racism, and inequality. And some of the outcomes from the social indeterminants are health disparities, education inequalities, ongoing racism, generational poverty, worsening of inequities, and suffering and death. So I'm going to touch on some of the same things that Leanne talked about earlier in her presentation. So some of the things that resulted, or that the social indeterminants were resulted from some historical trauma. So as Native Americans, we don't trust people that are outside of our base. We've had a lot of things that have happened to us that have caused a lot of historical trauma. And one of those things was boarding schools. A lot of Native American children were forced to leave their homes, to leave their families, to leave everything that they knew. As young and younger than my daughter. My daughter's 6 years old. I can't imagine being 6 years old and being forced to leave my family, which is exactly what happened. They were taken to these schools and they were forced to conform to Christianity. A lot of them were abused, physically, emotionally, sexually were abused. They were neglected. They were abandoned, and they also felt abandoned by their families that did not try to come and get them, but they were not able to do so. Forced removal, which I said, they were actually forced to leave their homes. And one of the major things that happened to them when they went to the boarding schools, and that Leanne talked about this too, was the loss of their culture and their identity. They cut their hair. They gave them haircuts that conformed to Christianity. They took away all of their traditional clothing. They gave them what we call white man's clothes. They forced them to stop talking their languages, and as a result, they lost their traditional. After a while, they lost their traditional beliefs and their parenting. So when the federal government created the Indian Health Service, it was very hard for many Native Americans to trust to even go there to get health care, because they didn't know whether they were actually getting health care or if they were being tricked into different tests, or they were infecting them with different things for research purposes. And some of that still exists today with some of our elders that we see, some of our patients. They're not very trusting. Most of our physicians are Anglo, and some of our elders have a really hard time in trusting, even if the providers are really trying to do the right thing. Some of the other things that resulted, some of the adverse childhood experiences from having having gone through the historical trauma and being in boarding schools are some abuse. There was a lot of abuse by teachers, by church people, by people that they thought they could trust. Neglect, substance abuse. That was a lot. That was a way that a lot of people chose to deal with having been in a in the situation that they were in, to try to forget where they were and what they were having to deal with. Mental health issues, witnessing of violence. So they witnessed their relatives, friends being beat, and sometimes even killed for speaking their language, for practicing their tribal traditions. A lot of children their parents experienced divorces. There was food insecurities, because that was one way to control, that they used in boarding schools to control, was to not feed the children or not give them enough food. And so there was food insecurities. The kids didn't know when they were going to eat again, where the next meal was going to come from. And as a result, growing up, a lot of their family members were in prison for crimes that they had committed. And a lot of these things just went over and spilled over into adulthood. So a lot of the things that we see in Native Americans that have been a part of historical trauma, that have been part of boarding schools, that have been part of negative experiences. We see a lot of alcoholism, behavioral health problems, suicide, poverty. Still, there's a lot of racism that exists in this country. There were very few positive role models. There were a lot of negative role models. What they saw were their family members drinking, domestic violence, a lot of drug abuse. They did not see a lot of their family members go to school to get educations, to get professional jobs, and a lot of them lacked parenting. And a lot of these social determinants have led to chronic diseases such as diabetes, obesity, mental health issues, alcoholism. Working in the lab, I did see a lot of young patients pass away from alcohol-related diseases. So what we strive to do at the Indian Health Service in the Phoenix area where I work is we try to incorporate traditions and treat the patient as a whole. We take into consideration traditional healing, ceremonies to whatever extent we can. We try to incorporate those cultural things to help with the healing for our patients. We have Sweat Lodge for men and women, which is also a traditional practice. We have talking circles in our behavioral health clinic. We really try to focus on treating the patients holistically, and bringing back the native culture, because we feel like if we can help tie the identity and the culture back to the pain and the healing, that actually will expedite the healings of some of our patients. So it's my goal to continue to do the best work that I can for our Native American people within IHS, and I will focus on programs and initiatives to help drive those programs and to facilitate some of the cultural loss that we have experienced over time for many, many years. So that is really all I have to share. If anyone has any questions, I will be happy to answer those.
Thank you. So,
Yay,
would you like-
mommy!
He's asking a question. Maybe it's better to stand up while you ask questions.
I got a question.
Thank you very much for your nice presentation.
Oh, thank you.
Actually,
I have a
I
question,
want
Mama.
to know one thing. What is the main target of your this PhD proposal?
So I work for Indian Health Service, and so our main goal is to provide the best care that we can to all Alaska Natives and Native Americans, and we want them to come to our facility because we feel like we have the programs and the ability to provide the care that they need because we understand what they've been through, and we know how we understand how we can try to facilitate the healing of our patients.
What is the Latin American and is there any difference or the getting facilities or the I think actually what is the difference between the Latin American and according to your views? What is your views regarding Latin American and the
Native American?
American?
So actually, they're very similar. We have a lot of the same kinds of traditions and cultures. Some of the Latin American tribes are actually native, so we kind of share a lot of the same traditions. I know that as for Latinos and also for Native Americans.
I can interrupt. Is there any racism in
absolutely.
respect to regarding racism?
Absolutely.
They are suffering.
Yes.
Latin Americans are suffering or not?
Yes. So we face a lot of the same racisms that Latin American people do. So like Leanne was talking about border towns. So we have our reservations. So it's kind of like, Mexico's just right there. So we are all aware on the news of what's happening and how people say go back to where you came from. And so we face that too. So all around the country, there's where they have reservations, there's border towns, and they face exactly the same thing. Go back to your reservations. We don't want you here. Yes, absolutely. So we do face some of the same racism, and even today we do. Up on the Navajo reservation, a lot of the border towns where we have to go in to buy our supplies or whatever. They're the same thing. Go back to where you came from. Go back to the reservation. We don't want you here. Well, this is our country. This is our country. So you really feel like telling them, you go back to where you came from. We were here first. So, several people have said, unless you are Native American, you came from somewhere else. This is our country.
Yeah. I think your thinking and what you are thinking is very congruent, I think. It should be. You run out.
Thank you.
I have a question.
What's your question?
I love you.
Oh. I love you, baby.
That's unquestionable.
It's unquestionable, yes it is. Questions?
Just thank you very much for your work. It's really insightful. I never stop learning about the history of this country over and over and over, so many levels of it. So it's really, the hidden history of America, what we didn't learn in school.
Yeah, because they don't teach you that stuff.
Yeah.
So my daughter she just finished kindergarten. And so when Thanksgiving came around, I asked her teacher, I said, what are you teaching her as far as Thanksgiving? Are you teaching her the traditional Pilgrims and Indians and the dinner? And she said yes, and I said no. I'm going to send you some videos of what the true meaning of Thanksgiving is. Because for Native American people, it's not a happy time. It's a time of genocide, because that's basically what they did for us. And I teach my daughter that because I want her to know the truth. And they should really teach the truth to kids, but of course they're not going to do that because it makes them look bad. So I want her to make sure that she knows the truth. And so I sent some videos to her teacher. I told her to educate herself. Her teacher was Anglo. And when I asked my daughter, what did they teach you about Thanksgiving, she did kind of alter what she was teaching to them. And so I did also let her know my daughter will not participate in certain events because we don't believe that, we don't celebrate that. That's not what we celebrate as Native American people. So it's interesting that you would bring that up, that, you know, because history is not told, the true history is not told in the textbooks. So it's up to us to teach our kids that, so they can in turn educate other people about what the true history of Native Americans are.
Are there any questions from Skype?
Are there any questions?
Yeah, well, and so is the native health, has there been any improvement in the last few decades, or in some aspects? For example, there was so much work on diabetes 30 years ago. Did it actually help, or?
Yes, there has been some. I mean, I'm not going to say that there's been leaps and bounds, but there has been some. The NIH has been conducting a 30-plus year experiment and research on Native Americans, specifically with the Gila River tribe. And there has been some improvements in as far as nutrition. They still try to incorporate the traditional foods, but producing them or fixing them in a more healthy way to be able to still be able to enjoy those things, but enjoy it in a different way, in a more healthy way. So they're really educating people on how to eat, what to eat, portion control, things like that. So yeah, there has been some improvement. There hasn't been, you know, a whole lot, but there has been some.
Do they actually cover good health care for Indigenous people?
Yes. So now in addition to the Indian Health Service, we also have tribes that have their own health centers. And so in doing that, they promote their traditional practices, traditional healings, traditional medicines, and they try to incorporate all that stuff into Western medicine. So yes, a lot of the tribes have their own health centers.
It's good to hear.
Yes.
Thank you. Do you have any questions on Skype?
Yeah, I have a question.
Yes, go ahead, Tahira.
Thank you very much. I really enjoyed your conversation, plus your kid. The question I'm asking is, when I've been to Phoenix, I've seen the condition, and I thought there was no way out. But then I compare with my country, like Bangladesh and India, and we were also colonized, and that colonization was also divide and rule. So that this should happen in your community, you all stuck together, and then you were put into a reservation camp, which I found to be very frustrating, because they were serving red beans and people had no jobs. So is there a long-term plan that you have, that young people get jobs, they stay there, and they look after their community, because most of them seem to migrate to other places because they're attracted to the money and everything, and they can go there, but this is their route, like you feel, and you have an affinity for your water, for your earth, for your people. So what kind of a plan have you all thought of in say mid-term and long-term, so that there's a remedy for this? Now you can't fight the United States. So how do you take that. We call it Bangla that shapo mare latio bhangena. That means the snake is dead, but my stick is not broken. So think about what are the possible long-term changes that could happen, which will bring prosperity to your community, preserve your traditional values, and also give your young people opportunities and future prospects rather than migrating to other places. Thank you.
So what's your long-term ambitions for healthcare? What could really improve the health of Native Americans?
So one of the things I would really like to see is I would really like to see what a lot of tribes have done is to really tailor the healthcare for Native Americans, move away from the Western medicine and really incorporate our traditional herbs and some of the ceremonies that we've had, and really pull in the holistic stuff, the stuff that we used before we had Western medicine. I think that we really should move away from just giving pills to people to help them with their ailments. I really believe that if we would go back to the way that we were before, that if we continued, or if we started up our traditional practices with our traditional foods and our herbs and the way that we used to live, I think that a lot of our health problems would decrease. And bringing that back and putting that in place would help a lot, and that's what I would actually like to see, and we are actually trying to do that at my facility where I work currently.
Do you have any connections with other healthcare centers that are similar with other, like I know on Oahu, there is a really interesting Indigenous healthcare center that started up in, if you go from Honolulu and straight up the coast there's one that really is focused on and run by Native Indigenous people to the islands. And they have really similar, only their own cultural questions and issues and things like that. And I'm just wondering, in terms of like the global Indigenous community, if you have any networking, like with other centers, either in this country or like something like that.
Absolutely. So IHS, where I work now, we actually have partnerships, and we try to do collaborations with other service units and other tribal communities. And we try to build those partnerships, and we try to work together with them. So whether it's in this country or other countries, we absolutely try to collaborate and see what we can learn from each other, see what other people are doing. So up in Alaska, and all different parts of the country. So absolutely.
Great.
Yes.
You don't need any more? No more? Okay.
Okay, well, thank you very much, Andrea. It's most informative. Okay, thank you.